It's been 5 years since the Singapore government declared a war on diabetes, but the fight against the disease remains a daunting task. The number of diabetic patients here has gone up, but experts say that this could be due to increased early screening. In today's SG Pulse, Sherlyn Sia looks at what still needs to be done in this battle against diabetes.
Across SingHealth, Singapore's largest group of healthcare institutions, which includes Singapore General Hospital, the number of diabetic patients has been growing at an annual rate of 6.8%, from about 130,000 in 2019 to 140,000 last year. And the number will continue to climb due to the aging population and rising obesity rates.
So I think there's more that can be done in this war against diabetes. From the national figures, we know that perhaps we have close to 400 to 500,000 Singaporeans with pre-diabetes. And we know that they are at higher risk of developing subsequent diabetes compared to the general population. So I hope there can be a nationally coordinated program to target this group of Singaporeans.
Meanwhile, this clinic at Mount Alvernia Hospital has seen a 10% increase in patients with diabetes over the last 2 years. But its lead doctor says it isn't time to raise the white flag yet.
With the increased knowledge, I think the motivation goes up. They understand the disease better, and that is always a plus point when we're talking about dealing with chronic diseases. So once a patient is motivated, it makes the doctor's job so much more easier. Then we can discuss with them, come to an agreement on the kind of approach and treatment that we would like to instill or institute in this patient.
And if diabetes-related complications can be better prevented, is a step closer to winning the war.
Through the efforts over the past 5 years, we can show that the incidence or the occurrences of diabetes-related kidney failure, blindness, amputation, strokes, and heart diseases are sort of going downtrend. I think if that is the sort of the outcome, then I think we may have done something good to reduce the burden of the disease. And in that way, I think we can celebrate a little bit of victory.
Of SingHealth's diabetic patients, Prof B says more than half are well controlled, an improvement from around 4 years ago, and it's looking to push that number up to 70%. Overall, 9.6% of Singapore's population, which is around 560,000 people, had diabetes as of last year. Back in 2010, it was 8.5%. Despite the increase, doctors say that isn't a sign of defeat, as it signals that enhanced screening efforts have worked.
That itself is a good thing, because that would also mean that we can start education earlier, we can instill a sense of right lifestyle choices in them, and if need to, we can start treatment earlier for them, so that we can prevent or rather reduce the risk of them developing complications later on in life.
Most of the credit has to go to the national program Screen for Life that encourages Singaporeans to go for regular health screenings and follow-ups. A digital tool that detects whether younger people are likely to develop diabetes has also helped. But as the experts have noted, the war on diabetes will be a long, hard-fought battle, as cases are just going to rise further.
In tomorrow's SG Pulse, we look at community efforts that help raise the awareness of diabetes.